right. Hello, everybody. I'm Brian, and this is AAMI News and Conversation. We're here at the second full day of AAMI Exchange in New Orleans, 2025, and I'm here today with two of our 2025 awardees. These are people who are hailing from India, and really, I would describe you both as change makers in India, make sure the biotech space and the biomed space is seeing the right change for an international stage. So I want to dive straight into that, but I should say Dr. Chekuri and Dr. Branham. And please introduce yourselves. Tell me a little bit about yourselves. So Dr. Branham, we'll start with you, ladies first.
Thank you. I'm Dr. K. Suseela Branham. I'm the CEO of BioValley, the BIRAC BioNest incubator arm of Andhra Pradesh Medtech Zone, which is a program run by Department of Biotechnology, Ministry of Science and Technology, Government of India.
Very cool. And I should say for Andhra Pradesh Medtech Zone, I'm going to be saying AMTZ for the rest of the time. It's easy for us to get through it quickly, but it's a very cool place, and I'm excited to talk more about it. But please.
Yeah. Hi, everyone. My name is Dilip Kumar Chekuri. By training and by profession, I'm a biomedical engineer. And it's been 20 years in this medtech sector in India, and looking forward to work with AAMI and the global partners.
So, Dr. Chekuri, I'm going to start with you to just on a very high level, tell me about what the Medtech Zone is in India.
So, Andhra Pradesh Medtech Zone, which is our parent organization, and MediValley is a non-profit Section 8 company, subsidiary of AMTZ. So, it's a medtech park, Asia's first integrated park, where we have solutions from A to Z for medtech. And right from 3-ply mask to high-end machines like MRI, we do at one place. So it is spread over 270 acres of land. So it is like 8-kilometer medtech city, you know.
Unbelievable.
And we house till now 155 companies.
160 companies and 81 startups.
So it's even grown since he last looked at the statistics. That's what I'm hearing. So that's we got MediValley, and what's going on at BioValley? Because I see the distinction here, right?
Yes.
We have our medtech, and then we have clinical representation. Is that right?
Yes.
Clinical representation is a part of BioValley. However, BioValley supports the technology development in the domains of biotechnology, convergence with medical technologies, biologics, diagnostics, in vitro diagnostics, regenerative medicine, and technologies coming under 3D bioprinting. Also, BioValley operates Center of Excellences, which are into medical device validation, the preclinical research center, the animal research studies in small animals and large animals. So we are operating a facility which has the certificate to conduct animals in rats, rabbits, mice, goats, sheep, swines, beagle dogs, mini pigs, guinea pigs, etc.
Sure. Lots of model organisms, whatever we need for the job done.
Yes.
Yeah.
And also an in vitro diagnostic kit validation center where the center validates or tests the in vitro diagnostic test for its clinical performance.
And this is an interesting distinction too, because a lot of the biotechs on the floor here today, they work with the device once it gets to them. It's already been validated. It's already gone through regulatory and whatnot. They might not know this distinction between validating a device and testing a device, right?
Yes.
So what's going on there? What is that distinction?
So he is into testing, I'm into validation.
Here we go.
So I think then
Yes.
good to
Let's
speak
start with
about
the
the
testing.
preclinical.
Just to give idea on how we created these two valleys, you know.
Yeah.
So I want to introduce Dr. Sharma, Dr. Jitendra Kumar Sharma, who is the managing director of AMTZ.
Oh.
So he took his Silicon Valley as and made these two valleys, MediValley and BioValley, complementing each other.
Yeah.
That's the beauty, you know. And in terms of MediValley, I deal with medical electronics, where we have set up medical electronics testing labs. You know, right from safety and performance we do at one place. So right from startups to big manufacturers, they have their own testing labs inside the campus.
Yeah.
So it saves lots of cost and the turnaround time to do the work.
Yeah.
So that's how it's been, and very helpful for these manufacturers and startups.
And this testing is really determining if the product is fit to hit the market, right? It's safe for patients and it also actually
Yes.
gets the job done. It's effective.
Yes.
But then when we go to the validation side, this is real world testing, right? We're outside of the lab environment now. So describe to me what happens during validation,
I'll just brief about a preface.
please.
During COVID, we could understand that having positive samples, like positive infectious samples like COVID, HIV, HBV,
Yeah.
syphilis, etc., are really scarce. And without having a positive sample, any in vitro diagnostic manufacturer cannot produce or manufacture an IVD testing kit.
That makes sense.
Yeah.
So that is where our managing director and founder CEO of AMTZ, Dr. Jitendra Sharma, he's called as a Medtech man of India. He's having such a big picture, and with this big picture, he has established the Center of Excellence, the Kit Validation Center, which validates the in vitro diagnostic testing kits of the manufacturers. And it is an Indian Council of Medical Research approved kit validation center, so associated with Government of India. And also with his insights, we have established one more center of excellence called the biobanking facility. So these biobank of AMTZ provides the characterized biological panels and supports to the in vitro diagnostic manufacturers for them to develop the diagnostic kits.
Okay.
So without those characterized biological panels, any IVD manufacturer would not be able to do that.
Right. You need
So
a baseline.
characterized biological panels for both infectious and non-infectious diseases are being produced at this center.
That's very exciting.
So with his big picture or the long sight, if in future any pandemic or any epidemic is forecasted, then biobank is the house where we can get the positive samples of every possible disease.
So I'm sure my viewers are saying, okay, these are two very impressive people. There's a lot going on in the valleys, the respective valleys right now. But I forgot to mention, because I was excited to talk about your companies, the respective awards you both won for this work, right? So in your case, we're talking about the Clinical Solutions Award, and you're our Iconoclast this year. So we've talked about already what you're talking about. Those are clinical solutions to problems that India was facing, just like you talked about with COVID. What about Iconoclast? What does it mean to be an Iconoclast? How does that work into the work that you're describing?
So, as we were discussing, there were no medical devices standards in the country in India. And the National Standards Body, Bureau of Indian Standards, they didn't have the expertise. That's where AMTZ as an expert pool came in, and fortunately I was part of it. And we created standards which are globally accepted because we are part of ISO IAC committees.
And we did even create for the exosome technology.
Yeah, which was not available in the national standards database.
Oh, okay.
And that is something which...
So that was a homegrown standard.
Yes.
Yeah.
As of now, the general guidelines for using the exosomes as raw materials and for the therapeutic use has been given. However, it has yet to be transformed to a standard, which we are currently working on.
Oh, great.
That's the beauty how we complement each other.
Yeah.
If there are no standards and we say, yes, we can do that because we have been doing this. And I was involved in formulation of 559 standards to start with. And then we needed testing facilities. So there was no testing facilities in the country. And that's how we created a testing facility which is run by a third-party service provider, which is TUV Rinland, who is well known globally. So TUV Rinland has a service provider giving a certification which is accepted by
On the international level.
internationally. So that's how we can able to export our medical devices to different parts of the world.
Oh, that's fantastic. I mean,
That's I feel that pushing the boundaries define the Iconoclast Award.
That's fair.
Even Iconoclast
Yeah.
word was not in my dictionary, and thankfully at the right time, Amy has recognized, and I'm very thankful to it.
Yes.
And there is more responsibility now how I bridge this India to a global level. So
You know what?
Yes. He at certain times really push the boundaries in terms of
Oh.
getting the job done,
Giving you a hard time.
giving me a hard time.
oh, seriously?
So yes, so he rightly deserves that.
I think that's a
And-
sign of a good partnership.
And he
though,
tries
too.
to,
You're
yeah,
supposed
and he
push
tries
each
to
other.
make
Yeah.
the company more revenue generated oriented. So yeah, he is certainly an icon.
I mean, whole AMTC is self-sustained.
Hmm.
Being a government entity, it's the first time. It's one of the fastest project which happened just in 342 days.
Wow.
Yeah.
Yes.
Wow.
So it's
And during COVID time, it seriously
Yeah.
rose high, and it
I
has
guess there was a
given.
need for it, right? So,
Yeah,
Yeah.
it has given almost.
for that reason, AAMI has recognized Dr. Sharma with the prestigious Lofman-Bash
Yes.
Award
It's our
in
biggest
2021.
reward.
2021.
Yeah, and he produced 2 other leaders.
You are.
With his leadership, India could supply, or AMTZ to India and outside world could supply around 10 million diagnostic testing kits,
Yeah.
wherein the need is 11 million.
Yeah.
Unbelievable.
And the
And-
ventilators and the
correct.
oxygen concentrators. 80% of country need went from one place. And it is something amazing which everyone has recognized then, you know.
Yeah.
And I
Yes,
think-
yesterday we were just talking. I was talking to Kim, where in USA, the army, and in India, we both are. And we came from long, and we could be recognized for our efforts at Bio Valley, Medi Valley, at AMTZ on a whole. And probably Dr. Sharma has really shaped us to get
To do
into
that,
this, to
yeah.
do that.
And
yeah.
you know what? I should thank also our friends at GCEA, the Global Clinical Engineering Alliance, because they helped connect Amy
So true.
with change
Very
makers like
true,
you two.
very
Yeah.
true.
And we're very excited to see what else comes out of them, and especially what comes out of the AMTZ and Medi Valley and Bio Valley.
We are really thankful to God to be a part of such an amazing ecosystem.
And it came at the right time. I mean, the whole universe is coming together to do something, you know.
We have to get international,
Yeah.
for sure. Harmonization. That's what Amy loves to see.
Yes.
And standards work is a one way to really bring that in, and the validation to make sure it's ready to go on that international market.
True. In terms of clinical engineering or clinical care solutions, during COVID, we could find that remote testing is completely unregarded. And last mile delivery of healthcare system is just not, there is nothing called last mile delivery. So AMTZ and Bio Valley, they have deployed the mobile diagnostic laboratories to the remote terrains, hilly areas.
Oh.
And that is one of the very, very remarkable clinical care solution in terms of dire need, wherein the patients or the human beings, they need to travel around 20 kilometers, or they have to walk down 20 kilometers up and down just to give the sample, leave about testing. And the reports used to take 3 or 4 days, and by the time we
Sure.
never know how lethality affects them.
Yeah.
So deploying rapid response mobile diagnostic laboratories is one of the clinical care solutions that Bio Valley AMTZ, with support of Medi Valley, has really been really did during the COVID times.
Is it BSL 3
Yeah.
level
It's a
lab
BL
on wheels?
On wheels.
On wheels.
Yeah.
It's a
I've-
container on wheels, it's completely transformed to a mobile diagnostic laboratory.
If we have a photo of this, I'll include it in the video
Sure,
for
sure,
our
sure,
Wow.
sure,
We
sure,
do
sure.
have.
That'd be wonderful.
And with that innovation thought, the succeeded are the mobile vans for ophthalmic testing, dental testing, assistive technology, rehabilitation. So rehabilitation now is being done in the vans. Even people at remote areas who can't come to Visakhapatnam, these vans are sent there,
Are sent.
so that the prosthetic legs can be given to them through this van.
This is one of the topics that's really common at AAMI Exchange right now too is that remote and outside of the hospital healthcare is so
Yes.
necessary.
Extremely.
Yeah, and here's another example of it right
And the
then and
future
there.
is home care,
The future is home
which,
care.
which actually the innovation are happening in these two centers.
Yeah.
Yeah.
Well, thank you so much again for bringing innovation from India now here to AAMI Exchange. And it's been really great to hear from both of you. Congratulations on your
Thank you.
awards.
Thank you.
And enjoy the rest of the conference.
Yeah, thank you so much for
Thank
Amy
you.
and our mentor, Dr.
Thank you,
Sharma.
AAMI, AAMI Foundation,
Yes.
and above all, thanks to God, thanks to AMTZ, and thanks to real Dr. Dijendra Sharma, who had really made this possible for us and had shaped us to move to and cross all the barriers.
Fantastic.
It will be one world, one health, I think.
Yes.
I love
That's
it.
well.
I love it. Perfect.
Thank you.
Thank you.